going to physical therapy 2 or 3 times a week, but then I'm trying to get this job at this gym and it's just not getting any better. In fact, like I'd be like 2 steps forward, 3 steps back because I kept just re-injuring myself.
Right.
I was doing the good stuff, but I wasn't stopping doing the bad stuff. I know from that experience, you just do your exercises for 4, 6, 8 weeks, whatever it is, the pain goes away. You don't have to do it anymore. But with the back, you have to maintain it. If you feel fine, it's still part of your daily, every other day routine.
Right. Welcome to another episode of Bed Back and Beyond. On today's episode, I am joined by kettlebell coach Emma Bonoli. Emma is here to discuss her herniated disc and the treatment options she chose to make living with a herniated disc doable. Emma will also discuss her kettlebell routine and how having a herniated disc has reshaped her approach with clients. Enjoy. Hi, Emma. Thank you so much for joining me on the Bed Back and Beyond podcast. I would love for you to just tell us a little bit about yourself before we dive into your injury.
Sure. Thank you so much for having me. This is such an important topic, and I'm really excited to get to talk about it a little bit. I am a personal trainer. I live in New York City. So being injured with a herniated disc was like really, really impactful to my life, given what I do.
I imagine.
I live in Manhattan with my husband. I am a personal trainer, as I said, and I am also super into like DIY and rehabbing real estate. My husband and I are real estate investors as well. So I just like constantly find myself doing things that could potentially irritate my back. So
how long have you been personal training?
Since 2016.
Did you go to school for that?
No, I went to school actually in Manhattan for costume design.
Oh.
And after working on Broadway for one show, I was like, this is hell on earth. And somebody I worked for said, like, if you could do anything else with your life, do it. And like that really stuck.
Oh, wow. Yeah, geez.
Absolutely not. I worked in international education then for 5 years for a nonprofit, doing a job that had like lots of travel. And when I wasn't traveling, I became obsessed with working out.
Mm-hmm.
And then the gym I was a part of like just kind of pressured me into becoming a trainer. And it was our gym was all about kettlebells. That was our only tool, kettlebells and your own body weight. So I like became completely indoctrinated on the kettlebells. And to this day, I am a women's kettlebell coach. That is what I do. I work with women in person in New York City. I also work with women virtually. I can chat about that a little bit. And I do have a big emphasis on back rehab and strengthening your core, because that is just such, even if you don't have herniated discs, lower back pain is like such a universal issue. So I try to address it with like every single client, and we do it with kettlebells.
That's great. So then when did you herniate your disc?
I hurt my back in the summer of 2019. So it was a while ago now.
Do you know how you did it?
I think that I did something that was the straw that broke the camel's back, so to speak. Mm-hmm. But I think I had just gotten really kind of reckless in my exercise in general. I was younger. I was just doing way too much without enough emphasis on core strength. And I was doing like a friend's challenge where you like did a lateral lunge with this dumbbell move, and it was only 10 pounds in my hands, and it was pretty strong. 10 pounds is not something you'd think you'd get hurt on. I just felt something in my back that did not feel right. And back then I believed like I could push through anything. So I just kind of ignored it. And it got worse and worse, and found out I had herniated my L4, L5. I think in the beginning it was just a, what's it called when it's not herniated? Bulging. It was just bulging, but it is no longer just bulging.
What kind of symptoms did you have?
So, I mean, as I think anybody who's listening knows, nerve pain is just really hard to pin down and constantly evolving. It started with some like general lower back pain, and then it progressed into like that really typical nerve pain that goes down like the back side of the thigh into the calf. And I had like that leg pain really persistently for quite a while. the back pain would actually go away. Like I would like if somebody like my physical therapist kind of dug into my lower back, I could feel some knotted areas.
Yeah.
But my main pain was in my legs, which is just so frustrating because you can't like work out nerve pain.
Right.
You just you're like twitching and shaking and you all know the drill.
I think the back pain comes from the muscles in the back respond to the injury by tightening up.
Yeah.
And that's part of that back pain. But the herniated disc causes that nerve.
Yeah.
Unforgettable nerve pain.
Yeah.
Did you have 2 discs herniated?
Yep. So it's the
Oh.
L4 and L5. And
Okay.
mine bulge backwards. So back extension kind of sucks them back in. And that's really what soothes my pain the quickest.
Okay. So then what was your progression to figuring out that you had a herniated disc? Did you go to a primary care or back pain specialist?
I am like the queen of physical therapy. So when I'm dear friends with my physical therapist, I'll just run to him anytime something doesn't feel right. So after about 3 weeks about being in pain, I went to him and I was like, something's not right. And so we just started focusing on general core strength. In New York State, physical therapists can't see you for more than a month without going to get a referral. So I just went to a spine specialist, got a referral, and he said, this seems like, or was it? Yeah, that was him. He said it seems like classic bulging or herniated L4, L5. A doctor showed me a dermatome chart. I don't know if you're familiar with that. It's a chart of the body that comes from with all of these lines that come from your spine. And it shows you the correlation of if you hurt this disc, this is where you're going to feel the nerve pain because it draws the nerves all over your body. And said, this is exactly what you feel. They did an MRI because I'd already been doing physical therapy. And I don't know, there's I swear I could coach people how to manipulate the medical system to get an MRI sooner than the doctors might, or than your insurance would initially allow you to. If you walk in and say you've already done physical therapy for 8 weeks, they will pretty much give you an MRI and take you at your word for it. So I did that. And it confirmed bulging discs.
Not that we're, saying do fraud, but
no. But I mean, it was true. I had already been doing physical therapy for 6 or 7 weeks at that point. And that's the buzzword. You did the PT, you're still in pain.
Yeah.
So I got the MRI and it confirmed it. But I was 4 years ago. I was 27, 28. And I was still quite hard-headed about thinking my body could do anything. And I was trying to get a job at a new gym. And if this is getting a job at a gym, you have to prove your allegiance and go and take a bunch of classes at the gym. So even though I was in pain, I was still taking a bunch of group fitness classes, which I actually don't believe in group fitness. I think it leads to a lot of these injuries. Because it's a bunch of people running around without paying attention to their form, doing things that promote injury. So I think that's how I ultimately went from the bulging disc to the herniated disc. So as I'm in pain, I'm going to physical therapy 2 or 3 times a week, but then I'm trying to get this job at this gym and it's just not getting any better. In fact, I'd be 2 steps forward, 3 steps back because I kept just re-injuring myself. I was doing the good stuff, but I wasn't stopping doing the bad stuff. So
do you happen to know how many millimeters you were herniated or no?
I don't.
No. Don't. I don't know mine either. Some people do.
Yeah. I never got too nerdy into the specifics of it. And I'm actually, it's not like me not to do that, but I'm sure a lot of people have heard this. They say if you were to image the general population's backs, 90% of us would have herniated discs. What's relevant is whether or not the discs are symptomatic. So I never really cared to get hung up on the particulars of my imaging because the reality was, regardless of what it said, I was in pain.
Right. Yeah. So my disc was kind of glued to my spinal cord with scar tissue. So the question is, how long was my disc herniated that the scar tissue developed? And I just didn't have symptoms before finally there was a major push. So you did physical therapy. Did you try any other treatments for your disc?
No, that was pretty much it. I did physical therapy. Well, that's actually not entirely true. I did the PT. My physical therapist is really great. He does a lot of manual work and exercise. So I did both, like getting a lot of, I wouldn't call it massage, but they like really manipulate your body into place. And then you
Okay.
do the physical therapy exercises to reinforce those manipulations.
Okay.
Not like
Not
a
chiropractic.
chiropractic
Okay.
manipulation. It's more muscular manipulation,
Okay.
and like manipulating your joints to sit better, your hips to sit better, realigning your pelvis, and then you do your exercise to reinforce that. One thing that he did for me that I had a lot of success with was kinesiology tape. Is that what it's called?
Okay.
The K tape.
Yes. Mm-hmm.
So he would tape my back up, and that would provide me a lot of relief. He was thinking that it was like lifting um, the muscles on my back up a little bit to promote
Right.
more blood flow to the area.
Okay.
And when it wasn't getting tremendously better quickly, I had not when it had been bad for a while, I started taking like an old Vicodin prescription, like a quarter of a tablet if I knew I
Right.
had to sit down for 2 or 3 hours, like I was going out to dinner, or I had a meeting or an event or something, because I couldn't sit. My
Right.
pain was exceptionally bad. The nerve pain would just come with sitting, like instantly.
Yeah.
And I told my doctor that, and he was like, well, we could give you like a Vicodin prescription, but I wasn't looking for that. I
Right.
was like, I would like a better solution.
Yes.
So what they had me doing was taking naproxen and Tylenol together
Okay.
nonstop, because what I was told was um, anti-inflammatories are actually helpful in this situation. They're not just giving you pain relief, they're actually reducing the inflammation in your
Right.
spine.
Okay.
And they're actually getting like reducing the inflammation enough that you can tolerate the exercise to make progress, strengthen your core, and support that. So that way you're no longer having that compression of the discs as much. Your core is supporting your spine better. You're not getting as much of the
Right.
jelly donut sticking out and hitting your spinal cord.
Right. And the
Uh,
inflammation is part of the pain process. It's
yeah.
pushing on the spine. I don't know that people realize that. It's not just the disc material, it's also the body's inflammation
Yeah.
process, adding pressure to your nerves.
Yeah. So I did this aggressive course of naproxen and Tylenol where I was supposed to take it every like 8 to 12 hours. And
Okay.
the idea was you never let yourself get back into pain. You
Right.
keep taking it so that inflammation goes down so you can tolerate exercise. And that
Okay.
really started to work quite well. But I
Okay.
developed a naproxen allergy
Oh,
in
geez.
the process.
That's not
Which
helpful.
stinks
Cool
for
it down.
me because
Yeah.
naproxen is a wonder drug with nerve
Yeah.
pain, in my opinion,
Mm.
or any sort of like joint pain. Naproxen's really
Oh,
helpful
goodness.
for. But that was I was doing that after I had art. We ultimately decided I would do a cortisone injection
Oh, okay.
into the discs, and that happened about 2 weeks before the injection was scheduled. So
It's the allergy. Okay.
I got hurt in like July 2019, and
Mhm.
in the middle of January 2020, I had the injection scheduled.
Oh, that's
So
quite the wait.
yeah. Well, no,
Yeah.
I didn't want it.
Oh, okay.
I in my mind it was a bad thing to get an injection. I
Okay.
didn't when I learned about how effective the anti-inflammatories were and what they were
Mhm.
doing to promote my healing process, I was like, I'll do the injection because that reduces the inflammation on a more aggressive level, or more it's much more centralized. So it's like actually just like really reducing
Right.
the inflammation where you have the problem, instead
Right.
of like destroying my stomach, taking a bunch of medicine every
Right.
single day. I was like, I'm going to do the injection and then I can do more rigorous physical therapy.
Mhm.
So that's what I did. And then the pandemic happened and I wasn't in the gym all day every day. So my body finally got to rest and I could
Uh,
only do the good exercise. And then I was better. I mean, I continued my physical therapy until we weren't allowed to do anything in person in New York. And then
right.
I resumed it. I would say like 8 weeks into the pandemic, you're allowed to go back to things like physical therapy. So I
Yeah.
did it virtually and then I went back to in person.
Yeah.
And
Talk about adding stress on top of stress.
I kept doing it for I think like 6 or 8 months after my injection.
Okay.
Because I
So
found like it was helpful. I found it very therapeutic and I was like, I got time. My insurance covers it. I'm going to keep it up.
So you got one injection. Was it at a hospital or a surgery center?
I went to Mount Sinai Spine Center.
Okay.
My
And what kind of
doctor is
injection?
one who like bragged that he did like Tiger Woods back surgery. So he thought he was hot shit, but I thought he was a big mansplainer and really
Right.
rude.
Right. Doctors.
I didn't like him.
Was
But
it an
he did
X-ray
it.
guided
Yeah.
injection?
Yeah.
Yes. Okay.
That was one of the reasons I was like, even though I don't like this guy, I'm going to go with him because he's saying that he's doing it in a safe way.
Yeah. Yeah. I feel like
And
that's the only way to do that kind of injection.
yeah.
Yeah.
So they did it. Was it X-ray or ultrasound? I don't know. It was
One of those.
guided somehow.
Yeah. Did you have general or twilight anesthesia for it, or were you awake for the injection?
Just local anesthesia. They just like numbed my back.
Okay. Yeah, so I did the injection as well, and they had offered me twilight, but I didn't have insurance at that time, so I couldn't afford the anesthesia, so they just gave me a couple Valiums. But I
They didn't
couldn't get
even
over
give me
how.
that.
Oh, really?
I was so stressed out. I was like,
What?
I would have 100% taken the
Yeah.
Twilight if they offered it to me. I was a mess.
Yeah. What I couldn't get over, though, was how quick the injection was.
Yeah, it was only a
I was
couple
like, "You're
minutes.
done?" Yeah, so pretty easy
And I don't
compared to
know
the
about
stress there is going into the injection.
yeah, and I don't know about yours, but with mine, they were like, "Don't do you." They're like, "You can't do your job like for 2 weeks."
Yeah,
They were like, "No picking up heavy things, no real bending. Like,
right.
let this area just settle for two
Yeah,
weeks." I've
yeah.
had like a lot of injections in different areas of my body since, and there were
Oh,
no
yeah.
such rules around other areas. So I thought that was kind of specific to the
I don't
spine one.
Yeah, I don't quite remember. Mine was 2019, so I don't quite remember my restrictions after the injection. Okay, so you did the one injection, then COVID happened, and you just rested your spine. Did you need any more injections?
I have not had one since.
Oh, wow.
And no medicine because I said I'm allergic to anti-inflammatories.
Right. Oh,
Tylenol doesn't
geez.
really touch the pain.
So are you pain-free today?
I would say 9 months of the year I don't think about my back.
Okay.
And of the remaining 3 months, a couple times I'll have a small flare where I'll just
Mhm.
be sitting there and I'm like, that's nerve pain in my leg.
Right.
But I'll pop down on the floor. I'll do some cobras, which for me, the
Yeah.
back extension really helps. I'll focus
Mhm.
on doing my core strengthening exercises, and next day it'll be gone. Won't think about it again
Oh, good.
for months and months and months. I can really manage my symptoms at this point so
Mhm.
well.
Yeah.
Um, but like once a year, I would say I get like a month-long flare up.
Okay.
And it always coincides with me having been busy and lazy and not exercising as vigorously as normal and not staying up with my core strengthening exercises the way I should.
Right.
And it'll be like, because I'm a trainer, I teach all day, I demonstrate things. So I'll go to pick up a weight. I won't have done my prep work on my core beforehand. And I'll be like, ooh, that wasn't right. And like, that'll usually kind of like if I get like a longer flare, it's like sparked by that.
Okay.
So that happened about a month ago, and then I had to go do a lot of work on a house, and um, it just it's still running its course, but it's getting better. I'm doing all
Okay.
my exercise, and
Mhm. Was surgery ever, an option for you or no?
I haven't seen a doctor for my back pain since I got
Mhm.
that injection.
Okay.
And the doctor I saw was a surgeon, and I asked him, I was like, do I have to think about surgery? And he said that for me, surgery would have been like he doesn't think like any reputable surgeon would do it because he kept saying my disc herniation was so minor. And I was like, well, it
Oh,
doesn't
okay.
matter if it's minor. I'm in a lot of pain. Um,
Well, that's unusual for a surgeon not to want to surgeon.
But my primary care doctor, who I've seen for like 10 years, I know her, like she knows me very well.
Yeah.
And one thing she and I have in common is we're both very anti-medicine, generally speaking. I'm like all for physical therapy, but like things you put in your body, we're both
Yeah.
very against.
Yes.
And she told me that she thought I was the perfect candidate for surgery.
Hmm.
In her mind, she said I'd go get the surgery, I'd walk out pain-free, and I am not overweight, so which is
Mhm.
like apparently if like statistically, if you have more weight on your body, the surgery has a lower success rate. So she said, since I'm not overweight, she thought it would be successful. And since I'm a trainer who's already doing aggressive physical therapy, I'd be very compliant with my post-surgery rehab. And therefore she thought it would be like a lifelong solution. Because I guess what my surgeon, or the surgeon who did my injection, told me is the problem with surgery is it's not a lifelong solution for a lot of people. They end up needing, like, the disc gets injured again, they need another surgery.
Right.
With people like me who simply have herniated discs. But if you're like you, where there was fusing, my father has had multiple herniated disc surgeries himself because of like severe stenosis, which is like the narrowing of the canal. You know, you have to reopen that canal. No amount of physical therapy is going to bring space to that. And the surgery can clear it out and then your problem can be solved. But for simply the herniated disc, it can reherniate after surgery. If you're not like really compliant with your physical therapy. And so that, I guess that's why the surgeon said, like, don't jump to surgery. But my doctor said conversely, she thought I didn't have any of the risks that make surgery not successful. So I don't know.
Are you pretty happy though with how your recovery has gone?
Yeah, honestly, I kind of agree with my doctor though. If I could avoid these like months of pain or random days of pain since I got hurt in 2019, by having had a surgery that made my life difficult for just 1 month, I might have been on board with it.
Well, I can tell you I still get flares even after I had surgery. So I actually woke up today like, I have nerve pain today.
So you know, all like it's my dad too. His pain's not totally gone after he had one surgery. A whole new kind of pain appeared.
Yeah. And then when I have really bad cramps, I feel in my surgical scar.
When I get really bad cramps, I get nerve pain.
Yeah. Yeah. It's just that inflammation. Great being a lady.
Oh yeah. So fun for us.
Right. So what kind of exercises do you focus on to kind of help keep that stabilization?
Yeah.
For your
So
back?
I love using a yoga ball, you know, like the big, but like a small one, not like a huge one. The ones in the gyms, I don't know if you can see my arms, they're like huge. They make ones that are more like this size, like they're better for women because we're just not that tall.
Right.
So using a yoga ball, I like to do bridging, single leg bridges, hamstring
lifting
curl.
your butt up.
Yep. So feet are on the ball. I mean, and if you're not there, feet are on the floor, but feet are on the ball and your hips go up and down. And then you do that with one leg, and then hamstring curls where your hips are up and you pull the ball in and out.
Okay.
There's a lot of exercises you do with the ball that you do, like leg raises where you squeeze the ball and you move the legs up and down, where you kind of hug the ball with your legs and you lift the legs off the floor, dead bugs with the ball. Okay. Basically, with core stabilization, you're going to get it's going to be the most effective if you're on an unstable environment, unstable environment. So by putting your feet on that ball, you actually then tap into your stabilizer muscles, as opposed to the floor where it's a solid surface. It's going to give you more strength than stabilization. But sometimes we need to build up some baseline strength in order to be able to progress to the stabilization. So like, I think when I started my exercises with physical therapy, my feet were on the floor, but now with my maintenance, I put the feet on a foam roller or a yoga ball or stability ball. Sometimes they're called. So that's like on the floor. And then, you know, I focus a lot on core strength, and all kettlebell exercises are core strengthening exercises if they are done properly.
Yes. The maintenance, you just mentioned maintenance. It's so important, even for, you know, you still have a herniated disc, so you have to maintain to keep the pain away. I had the surgery, but I still need to maintain. And I have the habit, unfortunately, of like waxing and waning. Like, I'll exercise till I feel better and then kind of drops off. Then the pain comes back. So that maintenance is lifelong.
And I had to learn the hard way too, that like, you can't just do the exercise till you feel better. Because with a lot of injuries, the physical therapy formula is you rehab it and then the pain goes away and you don't have to keep doing those exercises. I have rheumatoid arthritis, and it has made me very susceptible to injury. And I've hurt almost every joint in my body, largely through just normal things, like not exercise, but like bump my elbow, then I get tennis elbow. And so I know from that experience, you just do your exercises for 4, 6, 8 weeks, whatever it is, the pain goes away. You don't have to do it anymore. But with the back, you have to maintain it. If you feel fine, it's still part of your daily, every other day routine.
Right.
Which is unfortunate, but it's not a bad thing to have a strong core.
Yeah, that's true. So tell me about your fitness business.
Oh, sure. So I am a women's kettlebell coach primarily. I do have a few male clients from back when I was just more of a general personal trainer, but I tend to work with women of all ages, but most of the women I end up working with are over the age of 40 and no longer have super young kids. And they used to be active and they want to get active again because now they feel like they have the bandwidth for it, or because of an injury, they realized how important it is to now start exercising again. And I train people in a way that helps reduce pain or prevent pain. So we focus a lot on strengthening our core and our joints, which is just so important as we age, and strength training to help increase or maintain our bone density. So that's what I do with people. I'm not a fat loss coach. I'm like a strength coach.
Yes. Especially important for people who may be perimenopausal.
Yes. Super important.
Yes. Had you worked with people with herniated discs before you herniated your own?
Yes, but I didn't have the knowledge I do now. Like I've learned a lot about how to help people with all different injuries through like various continuing education, but there is nothing like hurting something yourself and having gone through the rehab. I always tell my physical therapist, I'm like, I should be able to expense this as continuing education because I learned so much from you every time I'm here. So
it brought new insight to your exercise routine.
It did.
Okay.
So that firsthand experience has made me feel much more confident helping people with herniated discs. And now I get a lot of clients specifically because they have herniated discs and they've heard my story and they want that help. And so I'm also like an online coach. I work online with people like on Zoom, which is amazing. And I also have this platform where there's I can like make you a custom program. And you get to learn how to exercise through videos of me explaining what to do. And then you send me videos of you doing it for some form correction. And it's like this really interactive platform. It's not like Peloton or Nike where they don't know what you're doing. We kind of interact through it. And I do customized programming that way. I do women's group kettlebell programs that way. And I recently made a core strengthening program for back pain that like is downloadable actually for anybody. I made that a few months back because people ask all the time, what exercises should I do?
Right.
And there's no one fits like, like one size fits all answer, but there are a lot of exercises that have helped a lot of people. So I put them together in like, you can do the program as fast as you want, but it's like a 16-week program of like 10 to 15 minutes, 3 times a week of exercise you can do to help strengthen your back and reduce pain.
So if somebody wanted to find you, where would they go?
So you can go to my website, which is emmabefit.com. You can also find me on Instagram, which is probably like the most accessible way to find me. And that's just Emma Bonoli. And on my website, you can find my links to my downloads. They're also in like my bio on Instagram, like very easy to read, direct links. I could share that back pain one if you're interested in it for this. But yeah, I work with people in all different capacities. I'm very customizable. So if anybody wants help, just like DM me and say, hey, I saw your video.
That's great. And I'll make sure to put the information on the screen for the YouTube video.
Thank you.
Sure.
So that's how people can connect with me. And I think that if you do have back pain and you're like dealing with herniated discs and you want to exercise, it's important to find somebody who truly understands what you're dealing with, because I'm not sure that somebody who hasn't experienced this kind of pain knows how to respond to it. Like, they don't understand that, like, if you feel a little bit of pain right now, that means 2 days from now you're going to be in agony. Or understand what your triggers are to keep you from feeling that pain 2 days later, because that often happens where you do something today, you don't feel it for till tomorrow or the day after.
Right.
So just if you want to work out with your back, you should still do it, but just be mindful of who you go to for guidance.
Right. Well, thank you so much for joining me on today's podcast. If you would like to find Emma's information, again, it is emmabfitness.com.
Emma B Fit.
emmabfit.com. And if you are looking for positive stories of recovery, please join the podcast, Bed Back and Beyond. Emma, thank you again so much for joining me today.
Thank you for having me.